Cancer Society has announced a revision to its mammogram guidelines. Now, for decades, doctors have told women to get screened for breast cancer every year, starting at the age of 40. But the group is now saying most women can wait longer. Lisa Stark joins us now from Washington, D.C. And Lisa, what are the details of these new guidelines?
Well, Tony, this came about because the American Cancer Society asked a panel of independent experts, go out, look at all the research on mammograms and tell us whether the guidelines should be changed. So here are the new recommendations: that women should begin regular screening at age 45, not age 40, that they get annual mammograms until age 54. Then they're saying after that, 55 and older, you only need a mammogram every other year. And they're also saying that there is no need for a regular breast exam by your doctor. So why this big change? Well, the Cancer Society says what they're concerned about is the risks from mammograms. Those can be false positives or overdiagnosis. It can lead to treatment, it can lead to tests, anxiety for women that is unnecessary. So that's why they've come up with these new guidelines. If you are between the age of 40 and 45, the Cancer Society says you can make your own decision. If you want, go ahead and have a mammogram. They're just not recommending it.
Wow, Lisa, this is huge. So how is the medical community reacting to this change?
Well, we talked to a number of doctors today. You know, they were up in arms a number of years ago when another independent panel said women don't have to start mammograms till age 50. They say at least this is a little better, although they still say, many of them say they would start their patients at age 40. But their big concern right now is all the confusion this is going to create among patients. We spoke with Dr. Charlotte Dillis from MedStar Georgetown University Hospital.
That is the biggest problem, I think, is that women are just going to throw up their hands and say, no, you know, nobody knows what to do and just forget about it altogether. And that's what we really don't want to have happening. I mean, mammography gives us an opportunity to save lives, and we need to make sure women are getting screened.
Now, the other concern among doctors and patients is what happens with insurance. If these new guidelines for some reason become the acceptable standard, will insurance pay for mammograms for women under age 45? Well, the American Cancer Society says it still believes insurance companies should pay for those. We'll have to wait and see. And Tony, one other thing I want to add, to be clear, these new guidelines are for healthy women who have an average risk of breast cancer. You know, if you have a family history, you have a high risk, obviously you should be screened much more aggressively.
Yeah. Lisa, help me with this one. What is causing the concerns about overtreatment?
Well, there have been studies that show many women, you know, when you have a mammogram, they're not perfect. It may pick up something. They want to take a closer look. You do another mammogram. You might even do a biopsy. And there are studies that show that there are women who needlessly have these treatments. It's expensive. It can be painful. It can also lead to a lot of anxiety. That's what these guidelines are designed to try to prevent.
Boy, big deal, big news. Lisa Stark for us in Washington. Lisa, thank you. A groundbreaking new study is questioning law.